Good morning. Welcome to At Your Service on KLAX TV.
Good morning, I'm Lola Davis-Michelle's At Your Service. We are continuing our discussion with Dr. Deepak Sharma. He is the medical director at Premier Urgent Care here in Alexandria. Hello again.
Thanks, Lola.
Talking about the flu season is underway, and really this is something that has taken its toll. Thousands of deaths occur every year.
Absolutely.
And so what we want to discuss here is the seriousness of the flu, and what is it, about 30% of the population probably get it almost every year?
Absolutely, Lola. You're right. You know, flu is sometimes underscored as an ailment, but it takes a heavy toll not only on our community but our nation as whole. Some estimates have said almost 30% of our population in the U.S. might get infected with the influenza virus. And it results in thousands and thousands of deaths every year because of flu or flu-related complications.
Okay. What are the high-risk groups?
That's a great point, Lola. There are certain group of people that are more susceptible. No one's immune to the flu, but the group that's highly susceptible is extremes of ages, patients that are less than 2 years of age. Patients that are older than 65 are high risk. Folks that have chronic conditions like dialysis patients, congestive heart failure, respiratory conditions like chronic obstructive pulmonary disease, patients getting chemotherapy, anybody getting any kind of medicines that immunosuppress them, like steroids, transplant patients are high risk. Pregnancy is another risk factor. If you're pregnant, not only are you at high risk of contracting the ailment, but your ailment tends to be a lot more severe. Okay. Obesity is another new concept. Patients that have a body mass index of over 40, or what we call morbid obesity, by itself is a risk factor to contract the flu.
I know you say it is important to get vaccinated. However, that doesn't necessarily mean you're not going to get the flu, does it?
Well, vaccine is still highly recommended. It's one of the most important things you can do to prevent the flu, but vaccine itself does not completely eliminate the chances of you getting the flu. And the reason being, the influenza virus mutates or changes or shifts in its structure every year. Researchers make the most educated guess as to what kind of virus would be prevalent for that year. Sometimes the virus may not be the same, and the vaccine you get may not cover for the viruses that are prevalent. So you're right, it does not always prevent. Another note of importance about the flu vaccine is once you get the flu vaccine, it can take almost 2 weeks for your immunities to develop. So after you get the vaccine, you're still susceptible. So be cautious around that window when you just got the flu vaccine. You may contract it. You know, antivirals are treatment of choice for influenza, but you have to take it early on in the ailment, within 48 hours. It can shorten your duration of illness. It can get you back up on your feet faster and prevent complications from the flu.
Thank you, Doctor.
Thank you, Lola.